Frovatriptan, trade name Frova, is a triptan drug developed by Vernlis for the treatment of migraine headaches and for short-term prevention of menstrual migraine. The product is licensed to Endo Pharmaceuticals in North America and Menarini in Europe. Pharmacology. Frovatriptan inhibits excessive dilation of arteries that supply blood to the head. It is available as 2.5 mg tablets. Frovatriptan has mean terminal elimination half-life of approximately 26 hours, which is substantially longer than other triptans. Mechanism of action. Frovatriptan is a 5-HT receptor agonist with high affinity for the 5-HT1B1D receptors. It has no significant effects on the GABA-mediated channel activity and benzodiazepine binding sites. Adverse effects. Serious but rare cardiac events have been reported in patients with risk factors predictive of CAD. These include coronary artery vasospasm, transient myocardial ischemia, myocardial infarction, ventricular tachycardia and ventricular fibrillation. Contraindications. Frovatriptan should not be given to patients with ischemic heart disease, cerebrovascular syndrome, peripheral vascular disease, uncontrolled hypertension, hemiplegic or bacillar migraine. U.S. licensing. Frovatriptan is available only by prescription in the United States and Canada, where a secondary new drug approval (SNDA) was filed in July 2006. References. External links. Frova, manufacturer's website. Frovatriptan succinate, patient information. FDA labeling.